listening to Honestly Aging by Friends Life Care VigR, a podcast where we explore what it's like getting older, the peaks, the valleys, and everything in between. In this season of Honestly Aging by Friends Life Care VigR, we're covering topics related to vibrant aging. I'm your host, Cheryl Proska. Let's grow old together. On today's episode, I'm joined by Kelly Harris, CEO of Cancer Support Community Greater Philadelphia. Kelly's held the CEO position for 14 years and has been with the organization for 22 years. Prior to joining Cancer Support Community Greater Philadelphia, Kelly worked in different social work related fields, including outpatient mental health, people with disabilities, and social casework. She also worked with the Department of Defense, placing special needs children with military families. In addition to her professional experience, Kelly has an undergrad degree in psychology from Cedar Crest College and a master's in clinical social work and social policy development from Bryn Mawr College. Kelly, welcome, and thank you for being here. How are you today?
I'm well, Cheryl. Thanks for having me.
Absolutely. So, Kelly, you're joining me today to talk about Cancer Support Community Greater Philadelphia, the organization's impact on the community, and how listeners can get involved. To get us started, can you tell us about the journey that led you to your current role as CEO of Cancer Support Community Greater Philadelphia?
Yeah, happy to. I had been working for many years as the director of an international adoption agency, and I came back from a trip and really wasn't feeling well. Fast forward 3 months, I found myself in the University of Pennsylvania needing treatment for leukemia, and I was told that I needed to have a bone marrow transplant as soon as I finished my first round of chemo. At that time, it left me unable to work for 3 years. And as I was considering going back to work, I really began to feel that I wanted to give back in some way. I was really so fortunate. I was feeling I probably shouldn't have survived my cancer, and I wanted to do something to give back. And I just happened to come across an ad in the paper that said they were starting up a new cancer support center in Warminster, and I applied for the job, and that was 23 years ago.
Well, thank you for sharing, a snippet of your cancer journey. I'm so just happy, and I just, this sense of relief that you are a cancer survivor. And through that journey, you have started putting yourself into, as we'll learn throughout the episodes, others and their communities that are impacted by cancer. So, I mean, in addition to your own cancer diagnosis and going through the treatments and recovery from that, what else would you say has been your biggest motivation in working with the cancer support space?
Cheryl, when we first started and people really started to come through our doors, it really became apparent how much support people who have cancer and their family members need. We were just overwhelmed with requests for services. People said that through their cancer journey, they were feeling isolated, they were feeling anxious. We had caregivers who said, they were so incredibly stressed. We had families who came to us who said, our kids aren't dealing with this well, they're not doing well in school. We just don't know how to manage life when cancer comes walking through the front door. And so, I really just learned that providing a sense of community where people can get these services, and all of our services are provided absolutely free of charge,
Wow.
that it really makes an incredible difference. We do a survey every year for the people that come to us. And we ask them, what can we do better? What have we done well? And the one thing we always ask is, how has participating in our programs helped you? And overwhelmingly, people tell us that they feel less anxiety, they feel less stress, they feel so much better that they can talk with other people who have been through that shared experience. And sometimes, that is just really the key, to talk with others who are going through the same experience that you are, because they get it. And, you're not trying to hide anything. You're not trying to explain anything. It's just that understanding between two people that have that shared experience.
And it sounds like people have the opportunity to really just be themselves as they are in that moment, in whatever, either individually or as a family, that they're going through in that cancer journey, where I feel like societally there can be so much pressure that, like, how are you doing? Oh, I'm fine. When
Oh, exactly.
really there's so much going on underneath of it. And just also something that really spoke to me with what you said was having the shared experience. That's so important with whatever you're going on in life, whatever is happening, to have that community with people who at least understand to some level what you're going through too. So just beautiful what you provide.
Yeah, thank you.
You in so many words said it in your last answer to the question. I do, being the CEO for so many years, I want to see if you want to really just clearly define the mission of Cancer Support Community of Greater Philadelphia.
Sure. Our goal really is to provide a community where people can come and participate in as many or as few programs as they like, in order to feel that sense of support, reduce stress, reduce anxiety, help them through their cancer journey. We have 7 locations across the greater Philadelphia area. And so we can meet people all over the 5-county area. We also provide programs virtually. There are a number of people that are just too sick to travel. There are people that are kind of far out in our service area, in outer Chester County. But we have a number of activities that we provide online, including exercise classes. So we want to make sure that people have access to us, access to the support and the community that they need.
Can you pick a few services and programs that you'd like to highlight for us? Maybe we could pick a program or two for the cancer patients, the survivors, and their loved ones. And we'll know that there are more available, but I just love to hear some highlights.
Sure. We have ongoing support groups. So we have support groups for the person who is in active treatment. We have support groups for cancer survivors, because, at the end of your treatment, when you're going through treatment, you always think, oh gosh, I can't wait till I don't have to do this. I can't wait till I don't have to have chemo or radiation. But for a lot of people, and I think most people, having your doctor say, okay, well, you're good, we don't have to see you for 6 months, that's a scary time, because, you've been followed so closely that, if you have an issue, you can talk to your doctor or your nurse practitioner. When they change your follow-up schedule, people get really nervous, because they think, well, what if it comes back? What if something's wrong and I don't have an appointment? So that's a hard time. So we make sure that we support survivors as they move into that time period, and we support them for a good year or two. I mean, they can come as long as they like. And then for caregivers, we have a support group. That is a very different experience. It's a very difficult experience to be a caregiver. What we see is that most of the caregivers that come to us are still working. They're the ones that are running the household. They're taking care of the kids. They're running to soccer practice. They're doing the grocery shopping. And that is just so much on somebody's plate. So we make sure that we always have a support group for them. We always have a bereavement program. Unfortunately, not everybody survives their cancer. So we want to make sure that we can be there to support their families and their friends throughout that. Then the other thing I wanted to just talk about briefly is our program for children and teens. A lot of times parents have said to me, we don't want to tell the kids, we don't want them to worry, they don't know. And the thing that we know is that kids do know. They sense that there's something different in the house. They sense that, mom or dad is sick. As it goes on, they might see mom or dad losing their hair. And so we really have encouraged families to talk about it. And we can provide ways to help. We have programs for kids. We have a summer camp for kids. And, the summer camp is great because parents can drop their kids off. They're here all day. We feed them. Parents can go home and rest. They can go grocery shopping. They can do chores that they're trying to fit in around everything else. So now they have a break. And, the amazing thing is all of these services are absolutely free of charge. We don't charge a penny for anything that people participate in.
And that I just want to open the door now to our this podcast is specifically targeted to older adults, and as we age, we come to oftentimes retirement age, and in retirement, individuals can be interested in volunteer opportunities.
Yeah.
So I'm curious if you could speak to whether your organization has opportunities for individuals to give back to the community and to volunteer their time or resources.
Oh, absolutely. Because everything is free of charge, we rely very heavily on volunteers. We need volunteers to help with some office work, copying, addressing envelopes. We need volunteers to help answer the phones. We need volunteers to come in. We have a monthly breakfast for men who are cancer survivors. We need volunteers to come in and help us cook those breakfasts. We get the food, but we rely on volunteers to help us prepare the meals. We need help with our summer camp. We need people to help make the meals for the kids. We have a whole array of things that volunteers can help with. And the really nice thing is it's something that people don't have to say, I'm going to come every week for 5 hours. They can say, hey, I can commit to 2 hours a month. Every hour is helpful.
Mm-hmm. Wow. I love that. Every hour is helpful.
It sure is.
And working in I work in the aging services field through my occupation. And something else that comes up is as we age, our social circles sometimes dwindle. And regardless of whether you are an individual impacted by cancer, it sounds like there's an opportunity for you to be involved in this community as this volunteer, as this person that has a bright smiling face for someone who may be having a down
Absolutely.
day, and maybe you are interested in helping with a men's group, or you are more inclined to be supportive of teens and children. So it just sounds like a wonderful opportunity that our listeners could explore in a couple of different ways. So I appreciate you highlighting all that.
If I could add one thing, the other part of our program that is really well attended are different types of crafts, arts and crafts programs. We have artists that come in and teach painting. We have a beading group. We have people that lead the beading group. We have a quilting group. We have people in the past that have taught knitting. So any kind of skill or hobby that people have, we would love to hear from them because that's something that they could do, a one-time workshop. It could be like a workshop over several weeks. Our quilting group is led by a senior volunteer, and they come in once a month. The group gets together, they bring their projects, and they've really formed a cohesive group. Now, after they have their quilting group, a lot of times several of them will go out to lunch or coffee, which is
Mhm.
really kind of an outgrowth of that kind of volunteering.
While we're on the topic, like specifically talking about older adults, are there any like services, support, or programs that are specifically targeted to older adults, or are older adults just incorporated across the continuum of services?
The biggest indicator of cancer is aging. So
Mhm.
as we age, we're more likely to get cancer. That's just a fact. So our median age is in the mid to high 50s and
Mhm.
above. So, we really see many more adults. Now, the face of cancer is changing a little bit. Younger people are getting diagnosed more, but the bulk of the people that we see, I would say, are from 55 to 95 that still participate in our programs.
Would you prefer to age independently in your own home or live in a nursing facility? I know what I'd rather do. Friends Life Care membership offers just that. Plan today for a future lived at home with vitality, independence, growth, and resilience while protecting your savings. Learn about your options at a free seminar or webinar. Register at friendslifecare.org/register or call 215-628-8964. I want to move on a little bit and depending on who's listening, we could have a whole variety people who have been impacted by cancer themselves and people who maybe don't have a lot of exposure to someone being diagnosed with cancer or themselves. So I'd like to just help our listeners understand what might some of the challenges be that these cancer patients are facing. And then, if you want to talk about how your organization helps to address these concerns.
I would say some of the biggest challenges, one of the biggest challenges, especially for older people, can be isolation.
Hmm.
They may have family members that live in another state or, kids and grandkids that don't live near them, and anxiety, depression. And I think it's not uncommon. I would say, in many ways, more often in the senior population, that when somebody is depressed, they will just isolate,
Hmm.
rather than reaching out. They often don't want to feel like they're a burden to anybody, even an organization. So I think that is a really tough thing for older people going through cancer, is just that. And, so when people walk through our doors, everybody knows, what they've been through. People are very welcoming, very friendly. There's always a pot of coffee on, there's always snacks in the kitchen. All of our locations, now we do have hospital based locations, but our other locations are in historic houses. So it feels like you're in somebody's house. We want to make it comfortable, we want to make it non clinical, because going through cancer, you go into enough clinical settings. We want to make this feel like you're going into somebody else's house. So, we have living rooms, and even our groups are held in living rooms and comfortable furniture. So we really try and make it kind of the anti-clinical setting.
Hmm. When we initially were preparing for this episode, you let me know that Cancer Support Community Greater Philadelphia also does community outreach to educating people about cancer. Can you talk about those efforts?
We do. We feel it's really important to talk to people about cancer. I would say, if you talk to anybody, I would say 99% of them will say they know somebody who has had cancer, right? I mean, it's just so common. Unfortunately, I always say, I wish I could say we were going out of business, but that's just not the case. So we make it part of our program outreach to go to various community centers, various companies, businesses, churches, civic groups. We'll do lunch and learns. We'll go out and do a talk about our services. We'll go out and talk about prevention. We'll go out and talk about, you know, different treatments that are available or screenings. That's
Mm.
a really key thing, especially as we age. The number of screenings that we have to get increases. So we go out and talk to people about the importance of screening, when they should get screening, by whom they should get that screening,
Mhm.
and just make sure that we have advice. We give out I just looked at some statistics. We gave out resources and referrals to about 1,000 people last year who were just looking for information like that. So we are always available to go out and speak to a group. And it doesn't matter how large or small it is. We just like to get information out into the community and help local families.
I don't want to put you on the spot, but you were talking about looking over the statistics of your impact. I'm curious if anything else stood out when you were looking over those statistics, because that might really paint the picture of the vast impact that you're having.
I can, because I actually was looking at them this morning. We have been in business for 31 years. Over that time period, we have served over 500,000 people, cancer patients, family members. The past year, we served about 2,600 people, unique individuals, and we had a cumulative number of people coming, could be the same person. So our cumulative visits to our locations of about 13,000.
Wow.
So, people really do utilize our services. And we try and, as I said earlier, people can come as much or as little as they like. We really try and help people identify what they might find most helpful. So, if a young mom with breast cancer comes in, with kids, we'll talk to her about our children's program. We'll talk to her about our breast cancer support group. We want her to have the opportunity to meet other women who are in that shared experience. And we want her kids to get support, meet other kids, have fun, get some therapeutic support, get to visit the ice cream truck that comes during camp, that kind of thing. So we don't just kind of let people loose and say, well, go to whatever you want. We really kind of help people try and decide what might be best for them, but they can go to anything.
So 500,000
Yeah.
individuals impacted positively by the work that you're doing. Oh, and over the course of your tenure with the organization, are there any stories that stand out to you as like, wow, what a success we had either with this individual or this person, or it could even be a particular group or program that you started?
I would say one of our most important projects or programs that we've done with the community is that at our summer camp for kids, we ask local businesses to sponsor lunch. We provide them with breakfast,
Mhm.
lunch, and then an afternoon snack, and volunteers help with all of those things. But we ask different local businesses to sponsor lunch each day. And, that corporate and nonprofit partnership has just really grown. We have people now calling us to try and get on the list to help provide lunch for these kids. And we ask that the companies bring the lunch, prepare it, And, they just really love it. Every year, we have local banks coming in. We have scientific testing companies. We have people from all different sectors coming in with their staff, putting together a great lunch for these kids and listening to them talk afterwards about how it affected them, the impact that it made on them, seeing these kids, some of these kids with cancer, some of these kids come in with feeding tubes, no hair. Some of these kids just lost a parent. Some of these kids have a parent at home who's actively sick or a sibling. It really affects them so profoundly that it's just amazing to me because they just feel that what they did made such a difference. And, quite honestly, for a lot of these families, food insecurity is an issue. We have a food pantry downstairs that we leave open for families to take with dry goods. And, when these kids are at camp, some of these kids eat so much, but, there's not a lot of food at home. And if we can help ease that burden for families, we're really happy to do that.
So, this is the Cancer Support Community Greater Philadelphia.
Right.
Can you more specifically say what is your coverage area, and then also how businesses or individuals can get involved from a volunteer standpoint?
We serve the entire 5-county Philadelphia area. So we serve Bucks County, Montgomery County, Philadelphia County, Delaware County, and Chester County. So anybody in any of those counties can access our free services. If anybody wants to get involved as a volunteer, they can call us or go online. We have an email information account that if you send an email to us and say, what your question is, we'll get back to you. We try and get back to people very quickly, but we will get back to you if we're really busy. It may take a day or so, but they can go on our website, which is cancersupportphiladelphia.org, or call our main number, which is 215-441-3290, and just say, I'm looking to talk to someone about volunteer opportunities.
And I'll link that email and I'll put the phone number as well as your website and all your social media
Great, thank you.
handles. Yeah, absolutely, in the show notes.
Great.
So looking ahead, what are your future goals and plans for Cancer Support Community Greater Philadelphia?
Our big plan is growth. We don't have a big footprint in Delaware and Chester counties. We're looking to grow that. We're looking for people to partner with. We'd love to provide in-person programming out there. People out there can come to any of our locations and participate in our online programming, but we're looking for ways to fund that and partner with someone potentially for space, and then we can provide the staffing, but growth really to make sure that we're able to provide everything that we get requests for. And that's, our budget right now is about 1.2 million. We feel like it should be at 1.5 million. And, a huge amount of each dollar, about 80 cents of every dollar, stays in our local community. So, we keep our overhead very low. We're very careful and frugal with money because we really want all that money going back to cancer patients and their families. This isn't about us. We really want the money to go back to the families that we serve.
And I feel like sometimes when I make a donation, I have no idea where exactly those dollars are going. And to hear you, and I mean, you're at the head and you've been there a long time. You obviously do a beautiful job. What you back up what you say, and any dollars that are going toward the organization, you are putting them back into the community and the individuals who really need it. So that's always good to hear.
And people can say, if people want their donation to be specifically for our children's program, we'll make sure that happens. And there's no donation that's too small to be helpful. We have people. I had a woman one time who sent me $5 a month every month, and I sent her a note every month to thank her because to her that $5 was a big gift, and that's very meaningful to us.
Absolutely. So before we close, I want to give you the opportunity to speak anything more that we didn't cover or something you'd want to impress upon more about your organization and cancer support.
I would say, if there's anybody out there living with cancer in any way in their families and you need support, call us. If we're not the right organization or you're looking for something that's outside of our scope, we will help you find resources that you need. You can start with us. We hope that you stay with us, but we're all about making sure that people get the support that they need. We're looking for volunteers. We always need somebody to come in and help us with projects around our buildings. And then, we have a number of special events that we do for fundraising, and we need volunteers for that. If people want to be on a planning committee or they just like to be on a committee that plans an event, if they've had experience doing that through their church or civic group. And then, if there's anybody that belongs to a civic group or a club, we'd love to come out and talk with you about what we do so that people have information that they can share with their community. But we are available to come out, daytime, evening, weekends, because it's that important to us to get the word out to people who may need our services.
Well, Kelly, thank you so much for
Thank
being
you.
here, sharing your individual story, and also all the impactful work the cancer support community Greater Philadelphia does. I encourage all of our listeners to visit your website, learn more, and be a part of your community.
Cheryl, thank you so much.
Absolutely. Thank you for listening to Honestly Aging by Friends Life Care VigR, a unique program focused on aging with vitality, independence, growth, and resilience. You can find links and show notes from this episode on our website at friendslifecare.org/podcast. Thank you to Kelly Harris for joining us today. You can learn more about Kelly and Cancer Support Community Greater Philadelphia by visiting cancersupportphiladelphia.org, Facebook, LinkedIn, X, YouTube, and Instagram. And thank you to Nick Dieterding for editing all Honestly Aging episodes. If you like our show, please rate, review, subscribe, and join us next time. To learn more about aging with vitality, independence, growth, and resilience, subscribe to our blog at friendslifecare.org/blog.